I have a question for the listeners. Do you suffer from migraine headaches? I don't, and I'm really glad about that. I have friends who do get migraines, and it's a terrible, terrible experience to go through one. And joining us on ODDIS Newsline to talk about migraine headache and what's new in the fight against them is Dr. Peter McAllister. Hello, doctor. How are you?
Good morning, Dan. How are you doing?
Fine, thank you. Now, for people who've never experienced this, and I hope they never do, explain what a migraine headache is like.
Well, I'm glad you haven't, but about 6% of all men, Dan, experience migraines, and about 18% of all women. That's 36 million migraine sufferers in the United States. And we're talking about a throbbing, moderate to severe headache with nausea, occasionally vomiting, light and sound sensitivity, concentration difficulties, dizziness, and really kind of a shutdown that leads to what we call disability, missing something. So a lot of my migraine patients can't get to work on the days that they have their migraine. They can't take care of their kids, and they certainly can't enjoy, family outings and quality time. So while nobody dies of migraine, the quality of life of a migraineur that's not being treated well is really pretty lousy.
Do we know what causes them?
Well, we know that it's strongly genetic. About 70% of migraine sufferers have somebody in their family who also suffers from them. And if you're kind of wired genetically for migraine, if you have the gene, many internal and external stressors in life can trigger them, such as hormonal cycles, lack of sleep, humid weather, certain foods, lack of hydration, too much caffeine or soda. So we have a good idea of who gets them and how to make them worse. So one of the things we concentrate on at the Headache Center is changing lifestyle and trying to get more sleep and exercise and stress reduction, etc.
With a normal headache, you take an aspirin or something similar and it goes away. That's not the case with a migraine. How do you treat a migraine?
Right. So, normal headaches, we all get those, and they don't knock us out of commission. They bug us a bit, and we take some over-the-counter medicine, and we're fine. Migraine is a medical condition, and it's treated by doctors. Interestingly, many folks who have migraine don't even seek out neurologists or headache experts. And in fact, there's a subset of migraine sufferers, and we call those chronic migraines. So chronic migraine sufferers, 15 or more headache days per month. So half the month they're in this cycle of migraine, lasting more than 4 hours in the day, and at least half of those headaches are migrainous with the throbbing and all. A study showed that 80% of them or more don't even have the diagnosis. So the first thing we do before we even get to treatment is we have to make sure people recognize that they shouldn't be suffering from frequent headaches alone. They should seek out care from a headache specialist or a neurologist.
Okay. That's good advice, and I can't imagine why a person would just put up with it. They shouldn't. They should go talk to the doctor. But what is the treatment for a migraine when you're actually experiencing one? Is there any way to
Sure. When you experience a migraine, we have a number of specific medications, and they fall into the class of drugs called triptans, and they turn off serotonin in the brain, which is one of the bad guys in the migraine cycle. For those who are having frequent headaches, and certainly those who are having chronic migraines for 15 or more headache days a month, there is one FDA-approved drug for the treatment of chronic migraine, and that is Botox.
Really? Okay. And how effective is it?
So there was a very large study. I was one of the investigators on it, and we looked at over 1,300 patients. And it turns out it was pretty darn effective. The folks who got the Botox and responded had about 9 less headache days and had about 40 less headache hours. So they were given basically a work week back of headache freedom.
That's going to be just tremendous for these people because it's such a terrible experience to have one.
Right. I mean, you can imagine having a few of these a month, but some of my worst patients have 18, 24, 28 headache days a month. That increases their risk of depression. It knocks out their sleep. It increases healthcare costs because they're going to emergency departments and, going from doctor to doctor and taking all sorts of medications. So to have a medication such as Botox that reduces the number of headache days and headache hours has been wonderful for my patients. And, it's a fairly simple series of injections around the front and back of the head and the neck and shoulders, and it lasts for about 3 months.
Oh, that's pretty good. That's kind of a breakthrough, isn't it?
It came out in late 2010 in October, and we were thrilled when the FDA looked at all the data from the study and said, you know what, this is legit stuff, and they approved it. So we now have something that's very powerful. It's not for everybody, but it's a wonderful medication to use to help out this chronic group of suffering patients.
Oh, doctor, that's really good news. Thank you for coming on and talking with us. If people listening now, especially people who suffer from migraines, wanted to get more information, is there a good way to do that?
Yeah, the best information I can give you is a great website called BotoxChronicMigraine.com. And on BotoxChronicMigraine.com, there's information on migraines and chronic migraines and Botox, and they can even type in their zip code and find someone who has interest and expertise in treating these conditions.
Well, doctor, again, thank you very, very much.
Thank you for having me, Dan.
Okay, take care, sir.
Bye-bye.